To be that advocate for your child, you need to kind of be sound yourself. I'm not saying, that you're insane, that anyone's insane, but you need to kind of be okay inside, right? And if you have no outlet, how can you continue to be that advocate? How can you continue to provide, to do your, day-to-day parenting, but to provide that, to meet the attachment needs of your child, to just continue to function and to be that parent that you want to be and you can be, if you don't have that support yourself. And again, I just feel like that peer support realm is so critical, because first of all, I don't think you'd be able to find a group of trained mental health professionals that also have the lived experience, to be able to kind of do this pilot project. I think you need to capitalize on, interested peer support members, but provide that training. Everybody says that they subscribe to family-centered care. Well, what is family-centered care? And if people were truly acting under that guise, then where is the mental health component, and why is that link missing from the picture? There's that saying, there's no health without mental health, and it's so true. In the beginning, I was saying inpatient, the setting there needs to be more support. And I agree, there needs to be more support. However, upon, I guess, realizing the extent of suffering that even, fellow preemie parents that I've known have gone through, ones that haven't had to deal with as many challenges, let's say, as myself in terms of bringing home 2 babies on oxygen, but even just the realities of having a preemie and then going home to no support, or to people who don't quite get kind of the life that you lived and the trauma that you experienced. I think that there's a significant gap in the community supports. And I guess that's kind of where my focus has kind of gone, I guess. I've realized it, not just, as I said, not just preemies, but families who are out there whose children are having dialysis, or whose kids are on ventilators, or who are medically complex, technologically dependent. Like, these families don't get a break either. And I think oftentimes they are forgotten about. And I think especially these parents, and if you want to, empower these families, and if you want to promote the best possible outcomes for the kids, and I'm not talking outcomes in terms of developmental piece at all. All I'm saying is, these parents need to be supported so that they can continue to be those advocates and be those caregivers for their children. It wouldn't be a service that would be forced upon people. And I don't see a person going into someone's home and doing counseling if that's not what they wanted. Even just having someone to talk to. So what I see this program kind of evolving into is, say, being run by a professional. So maybe it would be a mental health nurse. Maybe it would be like a mental health clinician of some sort. I say nurse because I'd love to do it, right? It's definitely a passion of mine. But I see the lived experience component as being huge. And I think it's an area that needs to be capitalized on, and can be. It's also cost saving in the sense that you're not hiring a team of, let's say, 5 or 6 professionals to do this pilot project. Instead, what I envision in terms of the community aspect of things, just strictly from a pilot project perspective, is to have, like I said, it run by, say, one professional, but you have training, whether it be mental health first aid, assist training, some sort of training for interested parents who have either had medically fragile, technologically dependent child, who've had preemies, who can basically attest to either what it's like in the NICU, what it's like having a child in the hospital, the isolation, who have that lived experience. And I think that is the most important, because, you know, if you don't have that, like, yes, you can have all the empathy you want in the world, but I think to actually establish a genuine, authentic rapport with somebody, you need to have some component of lived experience. And I'm sure you can attest to the same thing. Would you have wanted just some random, let's just say mental health nurse come into your home, sit there and say, I understand what you're going through, you know? And I mean, not in that condescending manner, but, you know, you could sit there and say, like, look, no, you don't understand, really. You have no idea what I'm dealing with. But I foresee it as a link between the public health or the infant, the regional infant development team, and your NICU, for example, or your children's hospital. And what I see it either as establishing a connection, like, okay, say for example, we'll take my case for example. If we were at McMaster and maybe at Mac they identified that, you know, I would be receptive and interested in this type of support, then what would happen is a referral would be made to the public health, or not public health, but whoever, the region. And then the person at the region would liaise with the hospital and would actually meet the family and just start supporting them in the hospital to aid in that transition home. Because the transition itself is huge. Going from like a hugely sterile environment, where, you know, cleanliness and all that stuff is such a huge focus, to the daunting idea of taking your child home or taking them out in public, or even the notion of getting them from the NICU or the hospital to your car and through the big public main lobby and the stairs and people looking or what have you, you know, or wanting. Some people, you know, they're trying to be nice, but they want to have a peek in, or God forbid, touch them. You know, all those things, just having that support in the transition, but also having that support after discharge. So I feel like if you are able to connect with them earlier and form that relationship and just kind of ease the anxiety just a little bit, I think it would have been a big help. And I know from my own perspective, I was very, very close with a lot of the staff at Sunnybrook. They would just randomly pop in and we just have conversations, and, you know, they kind of, learning more about their lives kept me in tune with what was going on in the world, right? Outside of my own nightmare. So a lot of me really missed that when I came home and there was nobody, you know? I didn't necessarily need all these people helping to support the care of the kids, although that would have been nice, but just having that person to talk to. I really missed out on that. Yes, I have these broad ideas, but certainly they could be tailored in multiple forms to actually have a concrete pilot project. So, you know, maybe I'm only able to develop something or do a pilot within the Halton region. I'm totally okay with that. It's a way that I'm dealing with my own grief, and I really think that there's never enough mental health supports. We all know that. First of all, there would be the benefit in terms of preventing huge exacerbations, let's say, in psychiatric conditions, it's upstream thinking, right? You're trying to prevent these ailments or people, experiencing PTSD, experiencing clinical depression, anxiety, before they begin, or at least maybe educating people to the warning signs. Like maybe they don't want the support right now, and that's totally okay. I'm not saying you have to force, every person who walks through the doors of a children's hospital to have, mental health support. But, if we can prevent things, if we can, outcomes in terms of providing positive outcomes to the kids. There's so much research to demonstrate with regards to attachment, positive attachment between parents and the baby. And obviously a parent's emotional well-being is going to hinder the formation of attachments. When your child is in an NICU setting or a hospital setting, attachment is different, right? You may not be able to hold your baby right away. For me, it was, 20 days, it was months, for Alexis, so you don't have that initial bonding. So already you are at risk for difficulties in attachment. So, if you support the mental health of the families, then maybe, in turn, you're also optimizing the outcomes for the kids. You're better equipping parents with the tools to cope, which in turn is only going to be a benefit to the children. Maybe it'll prevent, kids from needing a rehospitalization for, say, infection. Because sometimes parents are just going on autopilot. They're not thinking, right? And you can't blame them. They just are so overwhelmed, and maybe they forget to wash their hands this time, or they don't sterilize something, or they forget to give this medication, and God forbid their child as a result needs to be hospitalized. Maybe just providing that outlet for them in their home, in a setting that's comforting to them, maybe can mitigate some of these, illnesses or negative outcomes I see. Mm-hmm. If you don't ask, sometimes you don't know. Maybe it's not as overt, because sometimes people are very good at covering things up. Mm-hmm. And a lot of times, certain cultures, things are minimized, and, you're expected to put on a front. And there's no acknowledgement of mental health needs. But there comes a point when, when it's interfering in care, and maybe then you have to involve CAS, and, God forbid it goes down that path. If you could mitigate that through support all along the way, I just see that as a huge benefit for the family, the child, and the individual suffering. If there was, sort of a peer support program, or with a mental health focus available, I think I certainly could have benefited tremendously, and maybe it would have prevented me from having suffered so much and continuing to suffer, because it's not something that just goes away. Yes, my kids, everyone says, well, you got to focus on how your kids are doing now, and yeah, that's true, but it doesn't erase what happened. It doesn't make the grieving process any less. It just, I don't know, and I don't know how you eventually deal with it. Maybe just time, right? I try to celebrate all the successes that my kids have, but I can't erase everything that we've gone through, and I can't just shove it all down. So I think for me, in my kind of quest towards improving, or hopefully improving services and filling these gaps in services, my hope is that that's kind of my way of giving back and of grieving. Mm-hmm. I can't tell you how many times, people have said, you've lost yourself, and what are you doing for yourself? And I'm like, when do I have time to even think about myself, really? And I guess the same kind of rings true today, I'm back to work, I'm doing my master's, I'm doing all kinds of things, but I don't know, I guess my identity is kind of evolved in my advocacy work. I have an understanding both of what it's like from the perspective of being an NICU parent for a lengthy stay, as well as the ongoing challenges of having kids with, different, with special needs, and with kind of the technologically dependent piece as well. And so I feel like I'm well-rounded in that sense to be able to kind of provide such holistic care. I'll say care, but, again, I don't necessarily foresee this as being super, counseling based, or I think just having somebody to talk to, but also who has that professional or therapeutic kind of understanding, right? Plus the lived experience. Those are my two pieces that are kind of my non-negotiables, right? Someone on the team has to be a professional of some sort, but otherwise people have to have that lived experience. you can't possibly relate to these families and develop a rapport.